All right, KFUG Community Radio time now for, I guess we're still calling it Week 2, Health Matters. I've racked my brain a few times trying to come up with something, wittier.
Yeah, I'm not too much of a creative soul, but I think that's okay.
Lynn Szabo from Redwood Urgent Care, the PA running the show down here. We are here to talk over this week's Health Matters, which are...
STDs.
Oh.
Sexually transmissible diseases in Del Norte County.
Okay, now did they change the T since I was a kid?
Yes, sometimes it's STIs, sexually transmissible infections.
I've never heard transmissible. I thought it was just
okay.
transmittable.
Okay. No, I've always called it transmissible.
Okay. Well, you're the healthcare professional, so I will start calling it transmissible now. So
okay.
Because they keep changing the nomenclature, but really the diseases kind of stay the same.
Right.
Yeah.
We call them the usual suspects, actually. And as far as what's here, I'll talk a little bit about the individual diseases and how they impact us.
Here being where? Del Norte County?
Del Norte County. Chlamydia, a really common microbial disease, which oftentimes has no symptoms. In fact, that's the most common symptom. And in both men and women can cause infertility, and chronic pain issues. So it's a huge kind of big deal. Easy to diagnose with some good urine tests lately. So no more Q-tips, guys. No reason not to come in.
See, I can't sit still when you say things like that.
No.
Okay, but that doesn't happen anymore.
No, it doesn't happen anymore. The increase in chlamydia numbers in Del Norte County in the last 4 years, it's gone up by 5. So 500%.
Oh, by a factor of 5.
Factor of 5.
5%. That's just somebody.
No.
Wow.
Yeah.
Over how long?
Over 4 years.
Whoa.
Yeah.
Any idea why?
I think it might be because it's hard to get testing here, especially privately. I think it's also people coming into the community and stuff being spread around. I think we don't see ourselves as riskier as much as we probably ought to. So I think those are all the problems. The gonorrhea is actually worse.
Oh my gosh. Okay.
Yeah, gonorrhea is up 70% in 4 years. So the numbers are a lot higher, although the percentage is a little bit lower.
We're still talking about a higher incidence because of that one.
Right, and for a long time we hardly ever saw gonorrhea. And
really?
Then all of a sudden it's coming up here. I think Humboldt County numbers are even higher. Gonorrhea is a microbial infection that can also cause infertility and chronic pain, and oftentimes it runs in a group with chlamydia. So it used to be that we didn't really test too much for gonorrhea. In fact, we were told not to test for it because the numbers were so low. But shortly after that, the numbers seemed to be shooting up.
Now, I think
it's a big problem.
And gonorrhea is also becoming a more antibiotic resistant, right?
Yeah, totally. Right now, we only treat it with ceftriaxone, which is an injectable antibiotic. So it's not like you can get a discrete, couple of pills at the pharmacy and then hand them off to your partner. It's really something that people have to engage into the clinic setting to get treated. So, and then the big story actually is syphilis. Not so much of a problem here as it is in Humboldt County. Humboldt County kind of went from 0 to 100, it looked like, over the course of 4 years. Here we've been at 0 and now only have 1. So, but the problem with syphilis is they call it the great imitator and a silent killer. And so it's kind of hard for providers to diagnose because they haven't seen it lately. And it can cause a lot of damage because it can go undetected for years.
Oh wow! And you said it was because it looks like so many other things, right?
It looks like it could be so many other things, but it's been around for a long time. It just hasn't been here in our short-term memory. So the tragic thing with that, of course, is it can cause congenital abnormalities if it's not detected during pregnancy.
I'm sorry, I interrupted. Go ahead. Which is what?
And fetal demise. So it's sad.
What's happening with HPV? Because HPV is one of those things that just recently in my life came up and became a deal and became a thing. And I had daughters that were vaccinated for it, and so I have no knowledge. I didn't learn about HPV in high school. I just so both men and women can have it and can carry it and can spread it. Correct? Right.
It's a viral disease. It's been around for a long time. It just hasn't been recognized, and unfortunately, it's a cofactor with a lot of different kinds of cancers. So cervical cancer was recognized early, but also head and neck cancers and some types of lymphoma are HPV mediated. And if somebody smokes and they have HPV, or they chew perhaps, then the chance of having it go down the malignant pathway is really, really, really high. So something like in Humboldt County, the last stats I saw are kind of old, but if somebody's 30 years old and they've had 4 more partners, which is pretty standard, then the chance that they have it is like 90%.
Wow.
So they're just not aware that they have it. The 3 head and neck cancers that I actually found up here, all in young men who chew, were all HPV mediated, and they were pretty tragic for those 3 individuals.
Wow.
So, reminding from our last talk about the app Vaccines on the Go by the Children's Hospital of Philadelphia has a really nice little patient-centric information on why HPV immunization is so important, not only for women or for girls, but also for men. I've seen more HPV-related cancers in men, actually, in my career.
Wow. And I hear HPV. I know that men and women can both have it, carry it, spread it. But yeah, I from what I know, having not learned about HPV, in my mind it was a female disease.
Right.
But no. Okay, wow.
Well,
Okay,
most females probably having sex with men.
That's
males. So
I heard the cervical cancer connection at the beginning.
Yeah, the cervical cancer connection was, I think, recognized first, and the Food and Drug Administration did a lot of research, and so the research dollars were there. And now what they're really finding is that it's a mediator in a lot of different kinds of cancer.
Wow. Okay. One thing I don't see on the list, and this was the big deal when I was a kid. This was the most scary part of it, was herpes.
Oh, herpes.
What happened to herpes?
Oh, herpes, yeah. Herpes is really common. And a lot of people have it. If you've ever seen somebody with a classic cold sore, that is a herpetic lesion, it's a type 1 herpes usually. Type 2 herpes was thought to be genital, and type 1 was thought to be oral, but that was kind of somebody in denial about oral sex. And so because oral sex happens, there are a lot of people that will get type 1 on their genitals and type 2 on their around their lips, or maybe around their nose. So it is not curable. It is easily treatable. A lot of people have a lot of personal shame associated with it, but it's just a virus looking for a place to live. So it's not really tainting anybody's soul, in my opinion. It's easy to diagnose. It's easy to control. There's medication you can take for outbreaks. There's medication you can take to keep from having outbreaks. And it's probably important in this new, I guess, then now that we recognize that oral sex is kind of a way of transmitting this particular virus and HPV and HIV, that I should probably make a plug for safer sex with oral sex. So there are condoms that are specially made for oral sex, but not to be used for vaginal or anal sex. And there is also dental dams or plain old plastic wrap. So there's a really great reference called the American Sexual Health Association that has information about all these diseases, but started off as a reference for people with herpes.
Okay.
So that's online.
I remember herpes being the scary images in the films we watched in high school, right? And then now it's not even on the list anymore.
Well, yeah, I think it's an easily controllable problem, but I don't really want to. It's hard for people. It's a hard diagnosis to have, but it's something that we can really help them with.
So in the news recently, I guess there was a second person who supposedly had been cured of HIV.
Yeah, the London patient. Yeah, there was the initial one was the Berlin patient, and then the London patient. So HIV is actually fairly common up here. It's less than 1%, but that's more than I thought it would be considering the population. The risk in rural populations for transmission of HIV is in young women of reproductive age, of which we have a lot of here. And I think that it's most people who know they have it, who can get treated, can get their viral load down to undetectable, so the amount of virus in their blood down to below the levels that we can find it in the blood, and oftentimes that means that there's less transmission. That also, if people are getting good care and have a viral load that's undetectable, then they can also actually have children. Oh, wow. But they have to be, heavily medically supported. But the majority of people that have HIV in California don't know they have it. That's the problem. That's why testing is so important.
So, where can you be tested? How often should you be tested? What are questions that you should ask your healthcare provider
I
being
think
tested?
you can go see your personal healthcare provider. We are bound by privacy laws, and we pretty much have heard it all anyway. So there shouldn't be any shame in being honest with your healthcare provider. Teens have in some ways, more resources because they have special state insurance that they can use that keep their testing, treatment for STDs and birth control options private and confidential from their parents. And also those services are free. The only place for teens right now is Del Norte Community Health Center. They are incorporating their teen clinic into their everyday flow, and they say that they will make a commitment to seeing any teen that walks in who needs help, and then they can put them on that special California grant program, and then they can go ahead and do testing, education, birth control, treatment if they need it. Probably give them condoms and other supplies too.
And we were talking a little bit about just changes in the local healthcare scene, and that's one thing teens in Del Norte County don't have is a dedicated youth clinic, correct?
They did until recently, but I think there's been a provider shift at Open Door, and it used to be that they could go to College of the Redwoods and be seen kind of away from the usual office where they'd be less likely to run into somebody's mom or have somebody question why they're there. But that doesn't seem to be their procedure anymore. They encourage teens to come in and get same-day service. They might come prepared to wait a little bit, but the providers are dedicated to seeing them there.
Good.
So I always, anybody can walk in here and get information from me. I know when I worked in other sites in the county, I was also helping people with that.
Oh, okay. All right.
So there's, the thing about testing, it's kind of complicated. Oftentimes people come in and they say they've been tested for everything, and that means different things to different people. That can mean every STD test that you can get out of a cup of urine, for example, but that ignores all the ones that only have blood testing, or that is everything that your provider knows that your insurance will cover. So it's really, really important to understand that if you want complete testing, that you should get a blood test and a urine test and maybe even an exam, a test off an exam, depending on what disease you're actually talking about.
And these days, a lot of times the onus is on the patient to come in and ask for these, to specifically request this.
There's a big disconnect, I think, from what people think they're getting and what the provider thinks they're providing. And so I think it's really important to make sure that like for syphilis, that's a blood test. And to say, look, I was hoping to get a syphilis test, I understand it's a blood test. And then that'll look kind of, the provider can help. One thing that's also helpful, too, in Humboldt County is Redwood Urgent Care's laboratory. They have something they call Saturday Night Special, and I'll remind the listeners that you can go in and order blood tests on yourself. So they have a package for somebody who might be really wanting to keep this private. I think it's about $375, but they also test for 8 in that package: gonorrhea, chlamydia, HIV. It might be hepatitis B and C, and there might be a blood test for herpes plus a blood test for syphilis.
So you get the everything then.
Then you get pretty much the everything.
A Saturday Night Special.
Yeah. So, and then you don't have to go and explain why you need it. So you don't to a provider to get an order to get it done.
So we've never done this or even shared this number. Do you have handy the contact information for the lab? Do you have the phone number?
I would consider just calling going to the website's actually the best thing, redwoodurgentcare.com. But I also think that you could call the lab, and they're 707-298-2011. If you want to call here at the Crescent City Redwood Urgent Care, we're 707-460-1919, and we'd be glad to send you in the right direction.
Excellent.
There's one thing too about this testing that somebody should say. There's things called window periods, and that's the difference between the time somebody might be exposed for an STD and the time the testing makes sense. And that's one thing that's kind of lacking if you start ordering tests on yourself, is actually how to order them to your best advantage. So if somebody had an encounter and they were worried about let's say, herpes the next day and they didn't have any symptoms,
Mm-hmm.
to go get a blood test for herpes, a day or two after an encounter, you're not going to get the information. You're not asking the question of the test that you should be asking.
Mm-hmm.
So,
Can you test for something like that so soon, or do you have to actually
right,
wait
you have
for?
to have a window period. It's
Mhm.
like HIV testing. So from the time of the exposure to the time the test is helpful, and could be anywhere from, let's say, 8 or 9 days in the case of gonorrhea and chlamydia. I think 14 days is the window period for syphilis, but for something like herpes or HIV, hepatitis B or hepatitis C, the window period is more like 4 to 6 months.
Yeah, that's what I remember hearing.
Yeah,
About that,
so safer sex becomes really important
Mhm.
because you really can't get accurate information instantaneously for these testings have limitations. I probably should also mention that any test in medicine has false positives and false negatives. Some of these tests are really unlikely to have false positives, but if you get the testing done too early, you could totally get a false negative.
Yeah.
Yeah.
Wow. How often? And I guess it's a matter of lifestyle, right? Choosing whether or not you need this.
Right.
But how often do you recommend people, just your normal walking down the street everyday person get tested for these things?
Well, I think when you go into a new relationship,
Mhm.
I think that it's important to just update your testing, and depending on what your risks are and risk behaviors are, and you can talk to your provider about that. But I think the minimum would be gonorrhea, chlamydia, syphilis, HIV, knowing that the window period might affect
Yeah.
whether you get a false negative. Immunization, of course, can help, but every time you change partners, you probably ought to get tested at 0 point in time, and then 4 to 6 months later.
Okay. Yeah.
Okay.
Okay.
So safer sex is really important. I already kind of mentioned that there's condoms for oral sex, there's condoms for vaginal and anal sex, and then there's dental dams for oral sex too. All really, really important.
Because it's not, because it does come down to like point of contact. You can talk about knowing a person, you can talk about all these other things, but as you say, so many of these conditions and diseases people are walking around with don't even know that they have it.
Right.
So,
Right.
it really just is, no, here's the physical thing you need to have safer
Right.
sex.
Right. This is a germ that just finds a place to live. It doesn't really look for somebody who's a good
Who
person
deserves
or
it,
a
right?
bad person.
Yeah.
And then, the other thing I think to keep in mind is that most of the symptoms are no symptom.
Mm-hmm.
So when somebody says, I don't need to be tested because I don't have any symptoms, they really have the most common symptom.
Yeah, yeah. Wow.
So that's something to really keep in mind.
Mhm, mhm. And of course, as always, anybody has any questions, and as you said, requires any sort of direction, they're welcome to call or stop in Redwood Urgent Care and,
Yeah,
and
we'd be
talk
glad
to
to talk to them. Absolutely.
you. Okay, all right. And you are you have other?
Oh, I think I went through everything I wanted to, but I do want to say that I'm hoping that next week's topic can be why antibiotics don't work for viral syndrome. Or what do we do about the common cold?
So that's a really good one. So will you actually go into why an antibiotic? Because I know it's not a viral medication. It's for
Right.
for bacteria, things like that.
Right.
But why do you go into the nuts and bolts about how it can't hurt a virus?
Well, yeah, and why it's a bad idea, and why we don't really save you from getting sicker down the road.
Yeah, yeah. Okay, all right. So antibiotics coming up next week. Lynn Szabo from Redwood Urgent Care. Thank you so very much for this week's edition of Health Matters. Of course, Redwood Urgent Care open Monday through Saturday, 9 a.m. to 6:30 at, it's 286 here, right?
286 Suite B.
Suite B, right in Imster. It's where the workforce center used to be. And and the phone number is 707-460-1919. Thank you, Lynn.
Yeah, thanks. Talk to you next week.
All right.